of Pink Sari Inc. Thank you, Kashmira. To give you a quick introduction of Pink Sari Inc., which is also known as PSI. PSI was formed in 2016 with an objective to increase the breast screening rates amongst Indian and Sri Lankan women by creating awareness and importance of breast screening. Over the past 5 years, along with breast screening awareness, PSI has also undertaken BAL screening awareness workshops, mental health literacy project. PSI's current objectives are Beyond Pink and cervical screening awareness within the Indian and Sri Lankan communities. Both of our current projects are being funded by Cancer Institute, New South Wales. As part of cervical screening awareness, PSI works towards organizing activities and workshops to create awareness and share importance of cervical screening. Beyond Pink, our other current initiative, is an initiative to support and empower caregivers looking after cancer patients, survivors as well, with knowledge of resources and information that they may need. Before the pandemic and before our restrictions came into place, PSI had organized actually quite a few workshops face-to-face, and we were lucky enough to continue organizing a few of those workshops, even in a digital medium. We have, in Beyond Pink, also organized a few speakers to come, have invited speakers to come across and present in the areas of sleep coaching, creative writing. We were lucky enough to be able to host an art therapy workshop for cancer survivors and carers, which was very well received by the community. I'd like to make a mention here that being a community organization, the best thing is for us to be able to reach out to the community. And we encourage you, if you know of anyone who might benefit from these Beyond Pink program, or even who would benefit from the cervical screening workshops that we do, please get in touch. You can write us a message straight away, or our address is Pink Sari Inc. And I'm sure Kashmira will put these details on the chat of our email ID. Please get in touch with us, and we'd love to talk to you. We'd love to help you in any way that we could. Whilst I talk about PSI, I'd like to actually introduce my fellow team members. We are a team of 7 women who volunteer our time working towards achieving PSI's objectives. And it's with pleasure that I'd like to introduce each one of them to you today, starting with Anup Johar, Kashmira Sachanya,
Namaskar. I'm finding it, funny enough, I'm finding it difficult to pin myself. So
that's all right. Thanks, Kash. Dr. Rukmini Venkataraman, Rupa Parthasarthi, Vijay Dayanathan, who is unable to attend this afternoon. We also have in PSI our advisory committee, and the members of this advisory committee are Dr. Usha Salagame, who is unable to attend this afternoon. However, we have our other advisory committee member, Padmini Paris. And she is a Pink Sari breast cancer ambassador. Friends, coming back to our subject this afternoon, I came across a quote recently, which was to the effect and read as, "My anxiety is silent. You wouldn't even notice a change on the outside. But I'm honestly so stressed, I can't even manage simple tasks. People call me lazy, when in reality, I'm overwhelmed." How true. This quote is so real and relatable to people of all age groups. We as adults possibly take appropriate measures to cope and respond to these emotions. However, children, they would need their parents to support to navigate them through these emotions. This journey starts with firstly being able to recognize these signs of anxiety, depression, and then the next step, of course, is to then to be able to respond to these signs. The purpose of today's session is to enable and empower you and us by sharing information and resources that may be helpful to you. We at Pink Sari do not claim and or aim to provide you counseling, but rather present to you here 3 speakers: a child educator, a principal psychologist, and a child psychiatrist, all who are experts with vast experience in their respective fields. I'd like to make a mention here that after all the speakers have presented, we will have a Q&A session. So during the course of these presentations, please feel free to start writing your questions into the chat, and these will be put forward to the speakers by our Q&A facilitator, Kashmira Sachanya. So without further ado, I'd like to invite our first speaker, Saral Somaiya, to open this session. Saral is a passionate educator who has been teaching in various capacities for a long time, from role-playing as a teacher as a young girl to her current role as a deputy principal of a primary school in Australia. Saral's pedagogy and practice has evolved through countries and curriculum. Teaching in India, Saudi Arabia, and Australia has given Saral a great exposure to varied approaches and attitudes towards education and parenting. But the one consistent observation that she has made through her experiences as a mother and an educator is that kids are born with resilience. Over to you, Saral.
Thank you so much. Good afternoon, everyone. And thank you, Pink Sari, for inviting me to share my observations with you all. And I would like to give heartfelt congratulations to Pink Sari for the cause. And I mean, I have friends in this team and I know how wonderful as a team, how much effort you guys put in. So kudos to you all. I am going to ask you a question to start off. When I say the words stress, fear, nervousness, what comes to your mind? Does it make you feel good or not? I'm going to presume not. Is it really such a bad thing to have some stress, nervousness, and fear in our lives? Actually, no. These are our primitive emotions. These are our primitive responses. I'm going to refer to my notes here. I'm going to give you an example. When little babies start to recognize their parents, their mom, their dad, their immediate family members, and when they start seeing someone new, they start crying, right? That's a very natural instinct, fear of the unknown. But that's okay. It's okay to have that fear. It is a natural instinct that we have. Actually, it's a very powerful human emotion because it alerts us, it warns us of a possible danger so that we can take appropriate steps, actions to protect ourselves and our loved ones. Stress. Stress is also good because stress also keeps us alert. It keeps us motivated. It encourages us to do better. If I had no stress when I was going for an interview, I'll be very complacent. I will not push myself. When I bought my first house, I remember very distinctly when we took our first loan, I was so stressed. But that stress kept me on my toes to be vigilant about my expenses, to be sensible and make sure what my comfort zone is, how much can I push myself, and things like that. So fear, stress, they all have a very important role to play in our life. Well, then where's the problem? Well, the problem is, like they say, too much of anything is not good for health. Similarly, too much of any affection, any emotion is not good for health, be it fear, be it stress, be it love, be it joy. We need to have an experience of all the emotions in our lives, right? So what happens when we have too much fear, too much stress? We overthink and we are over scared of things, that's when it turns into anxiety. And if anxiety is not kept in check, it can lead to depression as well. So they're all very related things. So like I said, there should be it's not me saying, it's the world wisdom that too much of anything is not good. Anxiety, it is sad that I'm seeing in my experience as an educator, it is on a rise among primary school kids as well. I mean, can you imagine like a year 2, year 4 child being anxious? It's really, really sad. Like Aparna in her quote mentioned, I don't remember the whole quote, but the gist was that I'm so overwhelmed that I can be perceived as lazy. So true. So true. Kids do not know how to express themselves. They do not know how to seek help. So they act out. Sometimes they can have aggressive behavior. They could have fights, obsessive behaviors. So we as teachers, when we get these students, we first try to, use the normal strategies that we have in our repertoire to help these kids sort of stabilize and learn the law of the land. But when we see that it's not working, there is more to this behavior. There is more to this behavior. Then, the normal path is that we talk to an experienced teacher, or we talk to our immediate supervisor that, look, Joe Blow is displaying such behavior. This is what I have done to help him or her, but nothing seems to be working. I'm not able to settle this child. I'm not able to get him or her to do any work. Sometimes they'll cry for no reason. They'll hit people for no reason. Then we have school counselors. We have a learning support team where counselors are part of that. We bring this topic up, this child up in that meeting, so that if there is any more research, there are any more strategies that can be given to us, we try and implement that. If that fails as well, there is obviously something very serious. Now, we don't always wait for these steps. If it is something very serious and we have identified, we'll contact the parents straight away. But I'm just telling you the normal course of action. Sorry to say this, but when we meet the parents, all the secret is out. Many, rather majority of the cases, we come to understand why the child is behaving like that. We discover often that it is parental anxiety that is rubbing onto the child. Apple doesn't fall too far from a tree. So what kind of things do we see? Common trends in students. We see students don't want to sit on grass. I have seen parents do not get their child to walk on sand or grass or mud, constantly in shoes and socks, even at home. You need to connect with Mother Earth to get those energies. They don't do that because they are very scared of things. So they will feed that into their child. I have seen that one, I'll come in a moment. Kids, they wear jumpers in summer. Oh my goodness, the child is all red, but the parent wants to wear them, or want them to wear it. We go for excursions to Canberra and we write in the note, please wear layers so that you can take them off when you're on the bus and put them on when you're outside. But no, they wear layers of thermals for which we have to literally undress them. It's not about taking jackets off. Competition with other kids. Why? Why are you in competition with other kids? We don't understand. Be in competition with yourself. Then report cards. I remember very distinctly, I went not at my current school, but at one of my previous schools. When I first became an executive, I was hearing, oh my God, don't write like this. The parents are going to be very upset and this, that, and the other. And I'm like, well, if that is the case, let parents write the reports. I'll sign it off. Why am I spending hours and hours and hours gathering data and writing report on this child? So parents want to see the reports that they want to see. They are not allowing us to give them the real picture. It is about being politically correct. Then the other thing that frustrates me is everyone wants their child to get into selective. Everyone wants their child to get into OC. Ladies and gentlemen, I have come across a suicide note written by a year 6 child. That is traumatic. Why? And the child wrote, because I don't want to go to tutoring lessons. I do not want to get into selective. But parents think that is the be all and end all. If my child doesn't get into selective, that's the end of life for them. They think there's nothing beyond selective. That's so untrue. That is so untrue. We came to Australia, a land of opportunities where there is an opportunity for everybody. Then why are we trying to recreate the India, the China, the Sri Lanka? Why are we trying to recreate that when we came here for something different? The other thing that, may I use the word, frustrates me as an educator is, oh, next year, I do not want my child to be with this teacher. Oh, next year, I do not want my child to be with this student, this student, this student. I mean, do you think you're going to choose their boss for them, their work colleagues for them? Are you going to hold their hand all their life? No. Why don't you just let them be? Why don't you trust the school? We all have a work personality and we all have a home personality. So does your child. There are many students who are very introvert at home, but they are very outgoing at school, and vice versa. We have also noticed and observed some behavior. We also know that this combination will work, this combination will not work. And sometimes we have only so much room for movement. You have no idea how difficult it is when parents actually push us. And we really can't help you all the time. These are the kind of things, whether parents realize or not, but also develop a sense of anxiety in children. Because all they're hearing at home is, oh, I don't want my child to be with this person, this person. So this child is thinking, oh, I'm not supposed to get along with this person. I'm not supposed to like this teacher. Ladies and gentlemen, they have to work with different types of teachers, students, so that they develop that confidence and problem-solving strategies. I'm not saying every teacher is a great teacher. I'm not claiming that. But even a not so great teacher will have something to teach your child. I can guarantee you that. So that's what happens. Now, I would like to share a small example with you. So I have a fear of authority. So, for example, police. Whenever I see police, my heart rate just goes up. I haven't done anything wrong, but I just feel very afraid, when I see police. And I was just saying it to my son once, and he was grown up by then. And I said, Utkarsh, when I see police, mujhe bahut dar lagta hai. He said, mujhe bhi dar lagta hai. We just laughed about it. The other day I was driving and I was eating peanuts. So I was holding peanuts in my left hand and there was a police car behind me with the light flashing. And I thought, oh my goodness, there was this rule. You're not supposed to eat burgers and things when you're driving. Am I in trouble for eating peanuts? And I was so scared. When the light went green, I went right and the police went straight. And I shared this with my friends and we had such a laugh. And they said, you're such, you get scared so easily. I said, yeah, that's just me. But we laugh it out. Now, if I keep feeding that fear, if I keep feeding that fear in me, if I keep feeding that fear in my child, then we all are going to develop anxiety. So we need to be a little bit more self-aware of it. Also, Aparna, in her quote mentioned parental responsibility to help children navigate through these emotions. To be able to do that, we need to be very self-aware as well. I acknowledge that some of these cases are definitely clinical, genetic, circumstantial. When I say circumstantial, one child that I used to teach lost both his mom and dad. Now, obviously this child is going to develop emotions that are going to be so conflicting within himself. We do acknowledge that. But what I'm saying generally is the avoidable situations. Don't worry about whether your child gets into selective or not. A little child, when they start walking, they fall, they get up, they walk again. They fall, they get up, they walk again. They are resilient. If you stop them from doing that, they'll never learn how to walk and run, or they'll be having this awkward walk. Also, you must have noticed that when a child falls, when a little toddler falls, they're like taken aback. Then they look at the adult around them. And if the adult says, it's okay, they smile, carry on. But if that adult goes, oh, darling, oh, then the child thinks, oh, I'm supposed to cry now. And then they start crying. So then they develop that habit that, oh, I'm supposed to now cry because I had a bit of a fall. Children, we are not allowing them to fall and be hurt. They have this sense of entitlement because as soon as they ask for something, they got it. We are not allowing them to experience what it means to wait. We're not allowing them to experience what it means to be denied something. Then a common thing that parents tell us, oh, my child has been watching, playing games on iPad till 2 o'clock in the morning, and then morning they don't get up, and then they cry, and then they hit parents. They don't intend hitting parents, but by not sleeping, they don't know how to control that lack of sleep emotion. Then we say to them, take that iPad away, turn your Wi-Fi off. I mean, these are basic things, right? But we have to tell this to parents, that boundaries. We all need boundaries. Big, small, everybody, young, old, everybody. Everybody needs boundaries. We don't expose them to a lot of these things. So we are actually depriving them of real life experiences. They are born with natural resilience, but then instead of growing that resilience, we're actually holding them back from learning life skills. We can only hold their hands and do things for them and choose their teacher and choose their friends, maybe up to year 7, 8. High school, it's not going to work. And then in teenage years, when they retaliate, parents get upset. We need to sort of reflect and give each other some space, take risks, calculated risks. We all, waking up in the morning is risk. So we have to learn how do we take calculated risks. And ladies and gentlemen, I would like to just wrap up here saying that we all are born with resilience. Our kids are born with resilience. Let's feed that, not the fear. Let's identify that fear, stress in right quantity, in right balancing, act is good for us. Too much of anything is not good for us. And similarly, too much of love also, too much of blind love, too much of unconditional love is also bad for our children. So let's help our children grow the resilience that they are born with. Thank you.
Thanks, Saral. I love that. I think so well said that I think we need to grow the resilience rather than feed the fear or grow the fear or nurture the fear. And I think that's a great takeaway and something for all of us to sort of reflect upon. So thanks for that. Friends, I now present to you the next speaker for this afternoon, Poonkulali Govintharajah. Poonkulali is a psychologist and has worked in child protection, sexual assault, in immigration detention centers around Australia, and she currently has a private practice of her own, works with all age groups, children to adults. Her research article, co-written on the mental health of children and adolescents in Australia, alternate places of detention, that was published in the Journal of Pediatrics and Child Health, was a result of working with asylum seekers and refugees. She's the founder of Tharam, an NGO focused on raising mental health awareness in Sri Lankan and Tamil communities. Poonkulali is commonly also known amongst the circle as Punka. So over to you, Punka.
Thank you very much, Aparna. Thank you guys for having me here and the opportunity to speak today. Feeling very privileged in this position that you've given. And I also would like to start with thanking Sarala for a great introduction into our journey today all together. What I would like to quickly, recap is what Sarala pointed out around the difference between stress and anxiety. Yep, a little bit of stress is really good for all of us. It pushes us. That fine line gets crossed when it starts impacting our daily functioning, and that's when it becomes an issue, which is what Sarala had pointed out. And some of the other things as well that stood out for me was the factors that could possibly contribute to anxiety, which is unrealistic expectation and pressure by parents, perhaps modeling as well in terms of presenting their own anxiety and perhaps pressures. and the competition. And I guess there's that cultural aspect to that as well, coming from ethnic groups, particularly being migrants within, to a new country. There is that expectation and pressure to excel, particularly academically, and we're all kind of conditioned that way, and that gets passed on to the next generation and the next, and it seems to be some kind of legacy that we're passing on, yes. And also I heard highly protective parents as well, wanting the best, but I guess perhaps what I was hearing is too much cotton wooling. The children may not be helpful in strengthening that resilience. Okay, so on that basis, I'm going to jump into what I have got you guys prepared. Right. Okay, all right, let's start. So I guess my bit today is to focus on a child's journey in therapy, to give you guys a bit of insight in terms of what that looks like. And Dr. Rajeev will be extending this and giving you a more in-depth version of what I'll be covering. So Sala has talked about what happens at school in terms of perhaps challenging behaviours or certain anxieties that could present, and what the school would do in terms of speaking to the parents, speaking to teachers, speaking to support staff as well, and also getting school counsellors involved. So I guess where we fit in as a psychologist is when the school has done whatever they can, and then they find that, okay, this perhaps needs a lot more in-depth review perhaps, and perhaps the parents also need to be included in some kind of intervention. So generally what then happens is either the teacher or the deputy or the principal will speak to the parent. They then go and speak to the GP, and then they would give them a brief about what perhaps the teacher has said, and the GP would get a referral letter and go, here, you know what, go see the psychologist. And generally what that referral letter could look like is some of the stuff that you guys have got here. So I am going to obviously made up a fictitious character for this afternoon, Peter, whom will be traveling with us today. And Peter worries excessively. He's really angry, and he's hitting mum in particular, and he has difficulty falling asleep, and at the same time, though he's hitting mum, he also wants mum with him all the time. So this is what I guess as psychologists we may get, sometimes a bit more in depth, but I'm making things a little bit difficult for me today. So the next one would be, right, so I would want to find out what's happening in Peter's world. So generally what that would mean is I would speak to the parents by themselves and go, right, what's happening? And within that, get a vast amount of information. And what that would look like is beginning with what is Peter like at home? What is Peter like at school? What kind of temperament? Is he quite sensitive? And, you know, is there any genetic kind of aspects to within the family dynamics, meaning that is there a parent who perhaps has anxiety, if that has been already flagged by the GP querying, you know, perhaps this child has anxiety or depression. So that would be something that would be explored. Environmental issues could be, you know, is there conflict at home? Mum and dad getting along? Is it a stable environment? Is there drug and alcohol issues within the family dynamics? Is there domestic violence perhaps? And I'm talking about pointy end things right now. It doesn't have to be pointy end. It could be just more, you know, Peter could be rather sensitive, and he finds that dad tends to get angry very quickly, and that impacts him. So he finds that he walks on eggshells, and he doesn't like that, and that causes a lot of stress, which has now developed into anxiety because no one perhaps has identified that. And perhaps his coping mechanisms could be that he bottles it all in, doesn't necessarily talk to anyone, and perhaps it comes out as anger as his way of dealing with things. Style of parenting, I guess that fits in with Sala was also saying, in terms of, do we have a parent who perhaps shows a bit of tough love or tends to be overly lenient because they've got their own, perhaps their own, I call it backpack. We all carry our own backpack, and within that backpack could have, you know, a very heavy backpack or a light backpack, meaning that depends on whatever we have learned as a child, maybe, you know, when we become a parent, we might go, oh, that's something I'm never going to do as a parent, or hey, that's something that I would do. So style of parenting could be, if you're used to having a very authoritative parent, like these are the rules, this is how it's going to be, one would either tend to be a bit more like that parent, or tend to be, I'm never going to be that parent, so I'm going to be very, very lenient, giving it in, or perhaps ideas of, I never got this growing up, so I need to ensure that my child gets this, whatever happens. So that, I'm seeing a few smiles in the audience there. So that tends to be another thing that that could also perhaps impact one's parenting, and also parents' coping mechanisms. We all have our own way of coping. As I said, there could be a parent who gets angry quite quickly, or can't cope with things themselves, and that gets modeled, and this also gets copied by the child. So that's one part. The other part could be depending on what's happening at school, having a conversation with the teacher or the deputy, or whoever could have a lot of information about this child. Then get to meet Peter. Now with Peter, he's already very stressed because he's got lots of adults who's talking about him right now, and he's wondering now he has to go and see this complete stranger and have this conversation, and he may think, oh my God, I've done something wrong. He might feel that people are blaming him, or particularly if his anger has caused a lot of issues within the family dynamics, or perhaps even in the classroom, he might think that he's in some kind of trouble. So depending on what's in his mind, that perhaps we'll get what gets presented in the room, rather defiance, or not wanting to talk, or perhaps really wanting to get someone on board and be on his team. So generally how that happens is finding out what his interests are and using that as an emotional bridge to get into his world, finding out what's happening for him, what's stressing him, why does he think, you know, he gets angry? What kind of thoughts is he having? So particularly if it is more anxiety driven, and let's say he's worrying excessively, there might be thoughts about, you know, what if this happens? What if that happens? So for example, if there is some expectations and pressure placed on him to perform quite highly academically, the certain common thoughts could be, you know, I'm going to disappoint my parents, I'm not good enough, and that the response of that could be either wanting things to be perfect, which means that something that could take 5 or 10 minutes in terms of a task to get completed might take an hour or so, because he's constantly wanting things to be perfect. So he's scribbling it out and starting all over again, and this goes on and on and on, to the frustration of the parents as well. Or the flip side is he avoids doing the task because he would rather not do it, as opposed to failing or getting it wrong. Now, factors contributing to anxiety and depression, as I touched on, it could be also genes in terms of running in the family. One of the things I haven't got there is the temperament of the child again, and also the biology of it, meaning that basically in terms of there are, you know, certain things in there that particularly with anxiety that could release certain kind of hormones which may or may not be helpful. Thinking style, the thinking style could be quite negative. It's always quite defeatist. Things won't work out. Coping strategies, depending on the circumstances, depending on the child, the coping strategies could be not talking about anything, keeping it all in, which to the parent might seem, hey, the child's going really well, they're not saying anything. Or it could be a child that's constantly throwing tantrums. I generally tell parents that I'm more mindful of the child who's silent, because one doesn't know what's happening. The child who is exhibiting all these challenging behaviors is great. It's telling us something is not right in their world, and which is fantastic, because the teachers or the significant adults in that child's life will know this child is not coping, something's wrong. Coping strategies could also be self-harming, and we do see this also in primary school children, either with and largely with teenagers, but we're beginning to see a lot of this with primary school as well, with cutting, with hitting, with pulling eyebrows, hair. So this could be different ways of hurting oneself. We do look at that as a coping mechanism because they're finding it very difficult to, and Asala, some of the things that she pointed out was around, the awareness, the problem solving, the ability to adapt and to be flexible. And what we find is these are some of the things that they struggle with. So not knowing what to do, they want to get rid of the emotional pain. And the only way they could get rid of this emotional pain is by engaging in these kind of strategies. So that tends to be the way they cope. Stressful life events, it could be something like sitting for a selective school exam, as was pointed out. It's not the selective school exam that's stressful, it is the pressure and the possible disappointment that they feel that they would give their parents is what tends to burden them, as opposed to just sitting for the exam. Now, unfortunately, one of the things I tell the parents, generally whom I work with, is dealing with stressful life events. If they tend to have a blueprint that is not so constructive and tends to be quite unhealthy, this is the blueprint they will take for life, unfortunately. So even as adults, they'll find that this is a blueprint that will become their default position. So for example, they're going through something that is quite stressful, rather than going and talking to someone whom they know will support them and would listen to them regardless, and then try to problem solve and get a positive outcome. Instead of that, if they tend to bottle it in and avoid, and then tend to turn into more harmful strategies for themselves, this then develops over time. So as teenagers, it could be drugs, it could be alcohol, it could be risk-taking behaviors. It just becomes the same theme, but it becomes different packaging, basically, as they get older. So some signs of anxiety, I have just said a few here, but commonly what we would see is excessive worries, fears, overthinking. Some physical symptoms could be with little people, with primary school, could be butterflies in their stomach, difficulty breathing, or my heart beats really fast when I'm worried. These are some of the language that they could use. Anger, and it could be thoughts of, I don't want to be here anymore, it's all a bit too much. That could also be another one that comes in as well. Depression is feeling of sadness, low mood, not really interested in anything, withdrawing from family, friends, weight gain, loss, sleep could be a bit up and down, or more sleeping more than usual. And again, there could be thoughts of, I don't want to be here anymore, and self-harming. Aspects of treatment, if they have put it out there, either through school, that the school is aware that they have had some thoughts and perhaps a plan. And what I mean by plan is, okay, so I don't want to be here anymore, and I know what I would do to ensure that happens. We call that a plan. And if the school will then identify that and obviously tell parents, and if that comes through to us, then the parents also will be involved. And so we come across, a safety plan gets developed in terms to keeping that little person or young person safe. Same thing with the self-harming behavior as well. We'll all agree on the plan. The most important person who would be agreeing to this plan would be the little person or the young person involved. So this cannot, one cannot keep that little person safe if they're not going to be involved in this plan as well. So that's crucial. The other aspects is within the parent session, a large part of it is increasing their awareness and understanding, and most importantly, their empathy about the issues. And what I find is an adult's version of a problem tends to be, and the significance that they give that problem is quite different to a child's problem. So there's a lot of minimizing. Although that's not a big issue, they can, it's not really a thing. Why is he going through that? Well, we need to look at those issues through that little person's eyes. And for that person, it is a big deal that, they can't complete the task, or they feel that they're not fitting into school, or they feel that they're not connecting with their peers or friends. And then providing strategies for the parents to support that child at home around the issues, and particularly whatever that has been diagnosed, whether it be anxiety or depression, and making some practical changes. And what those practical changes could be, if that parent does get angry very quickly, then perhaps one of the things that the parent works on is to ensure that maybe they manage and regulate their emotions. And that also can be modeled to the child as well. Other aspects is, and I don't want to go into jargony words in this, but there are different types of therapies that we use. It's called cognitive behavioral therapy, or CBT, or play therapy in this instance when we work with little people and big people. Sometimes play therapy works. So increasing their awareness, why am I having these worries? What's happening to me? And then a lot of information around how the brain works, very, very simplified version of how the brain works and what's happening to them, and why they're thinking like this, and why they're feeling like this, and why they're responding. And what happens is there's a bit of relief that there's a label to this, and we can do something about that, and that gives a sense of hope as well. And then with that is then starting to work on these thought processes and responses, and giving them strategies to deal with it, as well as strengthening coping mechanisms. Now, the last one is barriers to recovery, and this is common in mainstream community as well, but specifically with ethnic communities, South Asian communities, is inconsistently engaging and completing treatment. So generally what we find is when there's a crisis, there would be persisting with engaging in treatment, and when things get a little bit better, we're all good, we don't need it anymore. And unfortunately, that is when we really need to work on things, because we've done the crisis work, everything is stable, but this is the bit when we actually start making significant changes, so we minimize things going backwards in the future. So this is the main bit, and unfortunately that gets that message gets lost. The shame and stigma of having mental health, and that again is still common in the mainstream community, and again more so in the South Asian community, about what will people say, what will so-and-so say, what will grandparents say, and it has a ripple effect. Now what that does is, particularly with children and young people, when they don't see their parents modeling and talking freely about it, they adopt that shame and they adopt that stigma, and they think something's wrong with them, which then means that they don't openly talk to their own friends about it. And so they're just living in silence, which makes it even more difficult. And the other barrier is parents' understanding of the issues, again, minimizing or dismissing or even comparing it to their own experiences. So, it could be coming from a Sri Lankan background, particularly when there's civil war, aspects of, particularly if it is the first generation, look, I've gone through the civil war and I'm okay, so what's his problem now? Like, why can't he deal with it? So that can also be clearly an issue in terms of now we're kind of comparing apples and oranges, which unfortunately doesn't work. Living in silence, and again, it will go away in time and child will grow out of it. So that's like saying, my arm's broken, but you know what? You're 7 years old. By the time you're 14, it will be fine. Your arm will be better. We don't need to do anything about it. The reality is your arm's going to get worse. You're probably not going to be able to use it well. And there's going to be some significant impact for your future self. And that's it. And I try to keep to time as much as possible.
Thank you. Thank you, Punka. Thank you so much. I mean, it's tough for a topic like this. I don't think sticking to a time limit is really possible. So I truly appreciate yours, Saral's, to really try to get it into the timeline and still be able to cover everything. I'm sorry, I have so much to say myself, but I'm not going to say it because I really want to stick to the time. And I'm going to now request our last presenter, Dr. Rajeev Jairam, child psychiatrist, who has just been appointed as Associate Professor Conjoint with Western Sydney University. Congratulations, Rajeev, from all of us here. Along with his recent appointment, he is the Director of the Infant, Child and Adolescent Mental Health Service, Southwest Sydney, and conjoined with WSU and UNSW. He has extensive research interest in several areas, including mood disorders, adolescent inpatient mental health, mental health and interventions for children in out-of-home care, and early intervention in child and adolescent mental health, and has himself got over 30 publications. He is actively leading multiple funded research projects. He is a passionate clinician, administrator, teacher, and is rediscovering his research skills. In his other life, he has been active in a number of community endeavors over the last 2 decades in Sydney, has been past president of Friends of India Australia, and is an active volunteer with the Health Professional Network. Dr. Rajeev Jairam, over to you.
Thank you so much.
Sorry, I'm so sorry to interrupt and stop this. Just to everyone who is on this call, thank you all for your questions that are coming in. And we will, just soon after this presenter, Dr. Raji finishes, we will get on to that session. So please keep your questions coming in and they won't be lost. And we have Kashmira who is actively noting them and will be addressing each and every one of them. Thank you. Over to you.
Thank you. And I do hope all of you can hear me and also see the slide. Thank you. Thank you so much, Aparna, for that very warm introduction. Yes, and obviously, as people have said, I acknowledge the traditional owners of the land that we're on today, and also very deeply appreciate Pink Sari for getting all of us together to discuss this really important issue. And we hope through these discussions, we'll be able to benefit mainly, yourselves and also the children in the community, not only directly here, but also later as the information is disseminated more widely. We've been treated to a couple of very, very interesting presentations. And I think Saral sort of spoke very much about practical on the ground in the school interaction with parents and children, what happens. And Poonkulali has been able to sort of talk through from a psychologist's perspective about, how one goes about managing these children. And so it's not left me with very much to say, but I shall see what I can sort of chip in. I'll introduce Maya and we can probably come back to her if you think she resonates later. A 14-year-old girl referred perhaps for, to someone like me or to a psychologist for significant outbursts, mood fluctuations, self-harm, being withdrawn at times, that there is, people in her family that have been depressed, but of course that's quite hush-hush. No one really talks about it as a problem. The school counselor and the mother have been talking and sort of they're both worried that she might try to hurt herself or try to attempt suicide. The mother, quite ashamed, is really not keen for anyone to be aware, to know that Maya's been having these kinds of thoughts and these kinds of problems. They've kept it from Maya's father, who's quite unaware of it, or at least they assume he's unaware of it. And the mother just, hopes that, well, I'll pack her lunch properly. I'll do whatever she wants. I'll try to fulfill her wishes. And I just hope that she'll get stronger and all of this goes away, that it's just a bad dream, that I'm going to wake up one day and everything will be fine. So for a lot of families, this seems to be a reality. And then you sort of have the other end. So both in India and here, I've been sort of practicing child psychiatry now for about sort of 21 years going. And some scenarios are quite sort of unusual. So one such unusual scenario would be say a 10-year-old or a 11-year-old boy waking up one day saying, "Mom, I've been giving you a lot of trouble. I've been feeling very anxious, very depressed. Please take me to a child psychiatrist, get me some medication and fix me up." So that kind of a child coming to us is actually very rare, almost doesn't happen. So what really happens? What happens is that these symptoms are noticed by different people and manifest in different ways. And I think that's quite important to understand, that not everyone manifests the same kind of stress and anxiety in the same manner, that the manifestations can vary quite a bit. And so we'll just take a step back and go through what really is. So when does a problem actually become a problem? Obviously, there are signs and symptoms. Like for fever, you can measure temperature in a thermometer. For diabetes, you can measure the blood sugar levels at different times. For hypertension, you can measure that. the blood pressure for diabetes, the sugar level. But in terms of anxiety and depression and other kinds of mental illness or other manifestations of stress and difficulty, they're not so obvious and evident. You can't give them a blood test. You can't sort of do a scan and find out. And so it is a little bit dependent on what is reported and whether it's reported to a person who sort of understands the issue. And if you understand it, and then how is that actually understood and acknowledged? So you do have those signs and symptoms. And the other thing is impairment. Now, lots of families may be able to cope with a lot of kinds of difficulties. Some kids may have significant obsessional behavior, but the family accommodates, and it might not be as big a problem for them as another family. So the fit between what these signs and symptoms are and the kind of problems it is causing the child themselves, it is causing the family around with their friends or in school. So these are different areas where information or the manifestations of these difficulties are picked up and then understood and reported on. Poonkulali touched up quite a bit. And I think it's really, really important to know that there are lots of studies that have found that manifestations of certain illnesses, especially the high-end illnesses, do have a genetic basis. So major depression, bipolar disorder, alcohol dependence, schizophrenia, autism, ADHD, all of those do have quite significant genetic markers, although it's not one gene, but it's a collection of genes. And they're not just because you have the gene doesn't mean you're going to get the illness. Say, unlike Down syndrome or Huntington's, there are some certain genetic disorders where if you have a gene, you have no choice. You are going to manifest it. But in a lot of these kinds of conditions, there is an advantage of the environmental benefit. It can either be a benefit or a danger, in the sense that there needs to be an environmental stressor or a signal that makes these genes identify or genes manifest. So it's a combination of both that is really needed. And so therefore treatment also, you need to look at both. Mentioned during pregnancy, because the thing is, everything influences a child, even before a child is actually born. So even during pregnancy, the kind of environment that the child is exposed to, both an emotional and a physical environment, makes a huge difference. Birth, really, I mean, that's the most stressful time of all our lives, where our brain changes, our body changes blood supply from the placenta into, it changes oxygen supply from a placenta into room air. And if that change, whether that change happens appropriately. So your Apgar scores and all that, as you would sort of ask at birth, are hugely important because they can have an impact. And then soon after birth, the first few years. Now, all of you have heard the first few years of life are very important. I'm sure everybody has repeated it at some stage or the other. And we wonder why. Why is this? Why are the first few years very important? What is so unique about the human child? And I think the most unique thing is, if you ever thought of it, the human child is the most useless creature on the planet. Absolutely the most useless creature. Utterly incapable of looking after itself. Utterly incapable. And within a few years, this bottom of the chain creature, I mean, even earthworm babies are better, capable of looking after themselves. But this creature, so, sort of not able to look after himself or herself, suddenly within a few years magically transforms to be the top of the chain, to be the numero uno in the planet. And what happens within a few years to effect this remarkable transformation? And what are the factors that actually affect it? I'm sure all of you would have heard about attachment. And then what is this complex sort of kind of development that happens, and what's the interplay of the genes and the environment that actually leads us to manifest what we actually manifest? Again, not enough time to go into detail, but I just like to touch upon. Now, the amygdala is one part of the brain. It's like sort of behind your nose. It's a very, very small thing. But that's the seat of emotional development. Now, what happens? What do we do with children? What do we normally naturally do? Or how do children actually learn? And like I said, what makes this transformation? What makes this transformation is the development of a secondary circuit in the brain. And what is the secondary circuit? We sort of learn through experience, learn through attachment, learn through our caregivers. What do children normally do when they when they experience unusual or novel stimuli, if they see an aeroplane or if they see a car, what are the things that they first do? First thing that they do is to quickly turn and look at their trusted caregiver, make some eye contact and try and gauge, okay, what's the kind of reaction? I think Saral touched upon a little bit about a child falling down and the parental reaction about what does that really mean? And that's generally how children learn. They learn by incorporating not only their own experiences, but the experiences of everyone around them. And they do that not once, but millions and millions of times. And what do we as adults normally do when we see children? We naturally exaggerate our emotional responses. Why do we do that? I mean, the way in which we talk to children are like, significantly sort of emotionally exaggerated. If we try to do that with adults, people will look at us and say, oh my God, this chap's gone crazy. He's acting, something's wrong with him. But the same behavior with a 3 or a 4-year-old child is very socially acceptable. And it comes to us naturally. And why do we do that? We do that. And when I speak about the delayed cutting of the umbilical cord, what I mean is not literal, but figurative in a sense that we endow these children with so many experiences that it's those experiences that are foundations of personality in later life. That unless those experiences and those foundations are laid properly, then this child will be playing catch up. So things like postnatal depression, significant sort of abuse, lots of domestic violence, or disruption in the first few years of life can have such a significant impact that these children will be affected one way or the other as they grow older and older. Not that they can't recover, because Saral spoke about how resilient children are, and that's incredibly important. They are quite resilient, but if they have repeated hits in a number of areas in a sustained manner, then something has to give somewhere, and they will manifest with some difficulties at some stage. So understanding all of that is really, really important. So I think we've spoken enough about genes and the brain insult. Temperament, again, Poonkulali touched upon the temperament. We're all born with different temperaments. Some of us are shy, some of us are anxious, some of us have most of us have easy temperaments. Some of us could have quite difficult temperaments. And it's about how that's managed in the environment. Spoke a little bit about attachment. And again, the Western literature talks about attachment as being between mother and child. Really, that's not the case, and really it shouldn't be the case. Children have attachments with a number of different people. It could be extended family, grandparents, brothers, sisters, childcare teachers, school teachers later. All of that makes a significant difference. However, the impact of loss, the impact of different kinds of trauma and abuse, which unfortunately is quite common, and in fact, probably one of the biggest hidden epidemics in our South Asian families, unfortunately, because it's hard to gauge, because a lot of it is normalized, saying that, oh, well, that isn't really abuse. Abuse is only if it leaves a very significant mark on your skin. Unfortunately, not the case. And so these children are very sensitive to expressed emotion of familial conflict. When I say E or expressed emotion, well, lots of them can be positive. I mean, they can be positive praise and things like that, but it can also be quite detrimental at times. And a combination of all these occurring for a significant period of time can eventually lead to a break of resilience and lead to the manifestation of a mental health disorder in these children. And that can be of various ways. Anxiety, depression are more common forms of manifestations of those disorders, and they can go off in severity. So things like meltdowns, and often younger children manifest not so much as crying, but perhaps having significant tantrums or out of control episodes, lots of anxiety. They can be locked in a shell, stuck to their mother or caregiver, or stuck to them and hardly speak outside. So I think someone raised social anxiety, and we can cover that later, and about sort of speech or selective mutism, not speaking in certain situations. Lots of distress can be experienced both by the child, and that distress doesn't go away. It tends to sort of seek different people within the family. So one time one person is distressed, and that distress is successfully passed to another family member, and so on and so forth. So really one of the messages is that, irrespective of how severe the problem the child presents with, they must be considered in the context of our environment. It's impossible to take the child out of this environment, fix them, and then give them back into this environment, and suddenly everything is fine again. It's really, really difficult to treat a child, external to their environment. Of course, parenting perspectives are again quite important. Really, that's one thing you don't really need a license for. Anyone can be a parent, but later on, as if you're really very serious about bringing up your child, having some questions as to whether yourself, you're a good or an adequate parent. If you don't have that question at some stage, then you're missing something. For a lot of our families, I think what we do lack is the transgenerational wisdom, mostly wisdom. Some can be not so wisdom, but in large instances it is. And so we are sort of left on our own, bring up our children, and we tend to question. So do we embrace traditional values, or do we embrace the values of the land we are in at the moment? And is it really the environment to blame for some? Or why does one child manifest certain difficulties, but another, his sibling, not manifest them? So is it really the environment, or is there something wrong with him? And then there are these flavors of the month. So when I say flavors of the month, what I say is that lots of parents do come to us saying, oh my God, my child definitely has ADHD, or definitely has autism or bipolar disorder. Please give him medication to fix him, or some of them are very anti-medication, or we've been sent by the school counselor to tick a box. They won't allow our child back in school again until we see you. So we need to see you, but you just say you have seen and everything is fine, so that way this child can get back to school again. So there are lots of reasons why consultation happens, and I think that's important. Or in the midst of all this, the child is usually the child's voice isn't here. I mean, here we're all, most of us are adults and we feel comfortable interacting with each other. But then unless you really hear a child's perspective, the complete picture is something that you won't get. Most often the child is quite confused, quite unsure as to how to respond, feels quite controlled by the environment. So they don't have a lot of choices. They don't have a lot of control, and they sort of react in ways that they know best, or what's worked for them. So whatever gets them some kind of a response from their family members is something that they'll continue to do. For example, now I'm speaking. I know it's online, but at least the faces that I can see are all sort of looking back and nodding from time to time, and that's keeping me going. Now, suppose somebody else were talking. Suppose 10 of you had yourselves unmuted and you were carrying on conversations with other people. There will come a time where I'll stop because my behavior of continuing to talk is no longer appropriately reinforced by your nodding and smiling and silence. And if it isn't reinforced, it'll stop. So, but then if these kinds of behaviors are continuing at home, or these children are continuing to manifest those behaviors, then something in them, yes, they could be problems from within themselves, but something in the environment is keeping it going. So understanding that is important. Understanding the impact of role models as well. I think we spoke about do as I say, do as I do, or different combinations of those. And finally, I think to sort of understand the underlying emotion rather than the literal meaning. What does that mean? That means that they can get so caught up over, whether that was correct, or whether who said that when, or whether him wanting a certain, to play a certain game at this time is correct or not. These are all the actual fact, or the actual event itself is usually not more important than what's the emotion that is being transacted. And I can explain that later if you need to. And unfortunately, what we also find is that depending on which profession you go to, they can all have different ways of understanding or manifesting, but understanding that a number of different ways of managing it, that it'll actually work, that there are various ways of understanding problems and dealing with it. And this is what I have captured here. I'll just go through quickly, understanding that I need to finish fairly soon. So where does the problem usually lie? So, well, there can be some difficulties within a child. There can be some in the environment, but in most instances, it's a little bit of this and that, a bit of this and a bit of that. Again, there's another story about the ghost of father syndrome, but I'll leave it to the end if there's time to talk about it. I think this has mostly been covered in terms of what's normal and the impact of various aspects on the manifestations of problems. One thing I'd like to touch upon is a trait or a state difficulty, and that's hugely important to sort of understand before you look to provide some treatment. Is this child always been like this, or is it a change in the last few weeks or last few months that's caused this kind of problem, or this child different from how he or she used to be, or is the environment different from how it was previously? Understanding that is absolutely crucial to formulating and then making a determination. And so unless we understand all the aspects that I mentioned, trying to intervene or trying to treat something without a full range of understanding will usually mean that kind of intervention may not be completely successful. And I suppose beware a little bit about fancy diagnostics. There are some that might say, we'll do some kind of test and determine if they have a problem. Usually most of them are pretty good money-making schemes. So nothing really beats spending time observing the child playing by himself and also with their caregivers. So that kind of an interaction and by themselves will give such rich information that you can then design your treatment. And before you jump into a mental health problem, just important to note that, are they eating properly? Do they have adequate clothing, shelter? Do they sleep well? Any physical illness, any other problems? Can they see and hear properly? And is the environment that they are in safe and nurturing and not really causing any difficulties? And that's really a basic check that needs to be done before you can jump in to say that it's a mental health problem. I guess it's more for people like me and Poonkulali in that the diagnostic label can have such a powerful impact. And so understanding the utility and impact of that is really important. Sometimes in issues of, say, separation and things like that, it can just have significant manifestations, including legal manifestations. Well, this is a slide generally to sort of quickly indicate that there are lots of things to consider. Does the child have an intellectual disability, or is there a developmental kind of problem? Lots of issues with specific learning disabilities and anxiety and depression. So things like dyslexia are really important to understand. Speech delays. I touched upon a little bit about autism, and again, if someone's interested, we can do that in ADHD. And all of these kind of exist as a continuum from borderline to mild to moderate to profound. And specifically anxiety disorder is important to be sensitive that these can manifest quite differently. So even if a child is anxious, they may manifest as having quite a lot of meltdowns or tantrums. And the range of disorders, so there can be extension of the attachment disorders, like I mentioned earlier, social anxiety disorders, phobia, separation anxiety, school refusal, obsessive compulsive disorders, and those related to trauma, abuse, and stress. So these are the common kind of manifestations in children. Really, when a problem occurs, the problem is not unsolvable or unmodifiable. It's usually the technique that's at fault, and if you change the technique, then you would be able to do that. This again, I'm happy for these slides to be available later. So once all factors are identified, treatment ought to be fairly holistic, and it does depend on a variety of factors. Psychological interventions, I think Poonkulali has touched upon, social, and then pharmacological or medication. And really, for us to be effective, some motivation for intervention must come from the parents and caregivers. So all of these are different manifestations. Some of them has already been touched upon. So the range of psychological ways in which we can manage these children, but I think a range of social ways. I think that's really important. Getting a good understanding that the therapist or the doctor or whoever is treating them and the family are on the same page, understanding the problem, and then deciding to do something together. Saral has spoken about the school and liaison. So for very young children, getting them ready for school and preparation, or transition for those that might go from primary to high school. Medications are used usually as a crutch, with the mainstay of treatment being psychological and social. And again, I'm not going to cover medications in detail here, but can talk about it later if needed. Understand that there are various kinds of medications that can be used, various number of anti-anxiety and antidepressant medications, and a range of other medications as well. But allowing enough time for parents to ask questions, clarifying doubts, understanding. And starting medications is easy, stopping it is quite difficult. So it's important to map out a plan to stop these medications. And that's absolutely crucial. And one must not start it without having a plan to stop them. So the last slide, really, in terms of having a few take-home messages, understanding that these children that come to us may have a problem. So it's children having a problem. Children are not the problem. So making that distinction is huge, usually, is extremely important. And the problem has a lot of causes. Identifying and understanding it is the first step. And it is impossible. So for most parents to feel that they can manage and treat everything themselves is very, very difficult and usually impossible. And it's possible to seek help sort of informally, in forums such as this, and a number of other sort of NGOs through the Health Professional Network. A number of other NGOs, SEVA and others, also offer some informal support and semi-formal support, and that's useful. Or the formal healthcare system, that's pretty good, and helping navigate it is also possible via the GP, school counselor, psychologist, and so on and so forth. And if it's significantly severe, then psychiatrists. A good partnership between professionals and parents is hugely important. Understanding that professionals may have different ways of working. But finally, if it's well planned, usually most strategies will have a great degree of success. And I think it's important to cherish and understand the children, because we do learn quite a lot from them. So I'm sorry I've gone through it fairly quickly, but again, lots to cover. And I shall stop sharing, and I suppose hopefully have some time for questions. Thank you.
Thank you, Dr. Rajeev. Thank you to all the speakers, and I'm sorry we've had to, in the background, send some messages and ask you to sort of wrap up, but it's just so that we have enough time for people to ask us questions. I would like to apologize upfront because we may go over the session by longer than 4 o'clock, as we have a few questions that have already come across. Can I please request, before we go into Q&A, for all of you who are comfortable to switch on your cameras, as we would like to take a group photo and of all the participants, just for record purposes. So I'm sure Kashmira will take that picture as and when she finds those cameras coming on. So please, if you could, I would appreciate that. And whilst you're doing that, I also want to continue just letting you know as well that we have a post-workshop survey that we would really appreciate if you take the time to fill in. And Kashmira will be putting on that link to the survey very soon on the chat. If you don't get the opportunity to do it straight away, I'm sure we will send you an email. And if you could still sort of fill in that survey for us, we would appreciate that. And when Kashmira is ready, Kashmira, let me know whenever you are ready. If you could sort of start the Q&A. I know we already have a few questions, but please keep your questions coming. If there's anything that you would like that has not been covered in the session today, please get in touch with Pink Sari Inc. We will definitely put you on to the correct speaker or to the presenter, whomever that you would like to get in touch with. And we would do that. So please, apologies if we haven't been able to cover everything in detail, but do send us an email, do get in touch with us, and we will do the needful. Over to you,
I'm
Kashmira.
ready to take the pictures if everyone is ready to say cheese.
Oh, okay. I didn't know. I should have kept quiet then.
No, that's fine. That's absolutely all right. People say cheese.
I think we've got to go through a couple of screens. So
Yes. Hold the pose.
excellent.
Everyone's looking so wonderful. Thank you so much. Thanks a ton.
Thank you. Over to you, Kash, for the questions. And at some point, you're on mute. At some point, if you can post that post-workshop survey as well.
Yes, I am ready. So the first thing that I want to do is to spotlight our speakers. And that is going to be So thank you so much, Saral, Punka, and Rajeev, for seriously a very, very informative session that we've gone through. We've got some solid number of questions, and therefore I'm not going to do anything but jump into the questions. The first question is, how is genetic induced depression, anxiety identified, and how can it be managed?
Do you want to take that one? Go for it, Dr. Rajeev.
Sure. Look, I don't think there's anything like a genetic induced depression. Like I said, there are several risk factors. So genes. So if there are family members, first generation, second generation, or immediate sort of brothers or sisters of parents who have had depression themselves, and a whole range of conditions associated with depression and anxiety. So it could be, for one episode of depression, multiple episodes of depression, attempts at suicide themselves, or manifestations of a lot of anxiety. All of those are linked to two things. One is that the child can have a greater chance of developing depression. And two, if that depression in the parent happened at a time that is quite crucial for the child's development, then it may have had a significant impact on the way in which the parent cared for the child at the time. So in some instances, it's a double whammy, both genes and environment affected. In certain instances, if it's a family member that's a little more removed, then it might only be a genetic risk. But needless to say, what it generally indicates is that if there's been serious illness in the family, then we probably need to take the manifestation of illness a little more seriously in the child, and ask additional questions like, okay, is there any particular medication or particular kind of intervention that helped in the family member? Because there is some evidence to indicate that if the grandmother responded or the mother responded to a particular kind of an antidepressant, then it's more likely that this child might also respond to the same kind of antidepressant if that antidepressant can be safely given in children, for example. Yeah, hope that answers the question. And there are some other manifestations of depression that can be purely, not purely environmental, but at least have a huge impact in the environment if there is abuse, or if there's neglect, or if there's any specific significant, sort of very significant bullying, or things like that that's caused the problem. I think we spoke a bit about significant, exam stress induced by parents and so on and so forth. So those also can happen as well.
Thank you, Rajeev. The next question is, can you talk about social anxiety?
That's a really big topic, as Dr. Rajeev would agree to that. So just a very, very simplified version. Social anxiety is pretty much fear of interaction with others, and that presents as, possibility of fear of people judging, what will people think of me, and how one deals with that is pretty much through avoidance. The more they avoid, the anxiety strengthens, unfortunately. So that's a very simplified version. I'm happy for Dr. Rajeev to add to that. But in terms of treatment modalities, there is medication pathway, and there's also therapy as well. Sometimes therapy is enough depending on the severity of that particular illness, and we look at it as a continuum: mild, moderate, severe, extremely severe. So if it is more mild to moderate, it can be managed without medication. It can be managed through working with, particularly with the child, working with the teacher. Certain things can be put in the classroom, working with the school counsellor, working with the parents, as well as working with the child as well. Dr. Rajeev, do you want to add to that?
Oh, no, I think you've covered it. It would also, I think, depend on the age of the child in terms of whether we would use medication. Obviously, younger children, we try and avoid it unless it is just so debilitating. But again, social anxiety as a construct will depend on the social situations the child is exposed to. Say, for example, the last couple of years with the pandemic and home learning and stuck at home for lots of these kids, you might not see a lot of children with social anxiety because their need to be exposed to social situations itself wasn't there. And so now we might then start to see some as everything reopens, and then you need to look at it as to, well, are they really anxious, or is it a response to the fact that they have not really faced any social situation for quite some time? And so taking the context is important, but again, it's the severity of the dysfunction, or what, what's the problem with the anxiety? What is it that is who is most worried, and what kind of disability is the anxiety causing, and of course the age.
The next one's for Saral. Talking of OC and selective, should we not ask our kids to study sincerely and do their homework? I understand most kids tend to play and not get serious, but isn't sincere study important too?
Sincere study is very, very, very important. Sincerity in whatever we do, whether we are studying, we are cooking, we are having fun with friends, we got to be sincere everywhere. I hear your question. That is not what we are implying. At least that's not what I'm implying, that, don't tell your child to work hard. Of course, they should work hard. In fact, I tell parents that, let them sit the selective test just for the fun of it, just for the experience, because primary school students do not have any exam experience. The problem is when children are not allowed to pursue their hobbies. Oh, because you have to study, prepare for selective, go to coaching. They can't go, when I go around to wish birthday to students and I ask them, so Joblo, what are you doing for your birthday today? Oh, nothing. Why is that, darling? I have coaching today. No. That is something we don't encourage. But you know what, at the end of the day, it's parents are the decision makers. But when I sit down with parents, I would like to share a very quick episode with you. So a parent at our school, his daughter did not make it to selective. Very, very upset, very disappointed. He said, Mrs. Somaiya, I would like to come and meet with you. I met with the husband and wife. I spent over an hour with them. And the crux of my conversation was only one, that, Mr. Lee, are you trying to tell me that your child is no good just because she didn't get into selective? Are you trying to tell me that your child is no good just because she was not able to get into this particular selective school? You're trying to tell your child there's no hope for her? That was the crux, but we went on and on for an hour. That parent left my office and sent me an email saying that I'm feeling so relaxed and I'm not feeling stressed at all. I think we work ourselves up. We see that people around their child, be proud for whoever gets into selective, but don't show your child down if they do not get into selective. Try your very best, but sometimes even despite trying our best, we don't make it, and that's okay. So yes, ask them to work hard, not for selective, work hard no matter what. As teachers, you know what we see? We see that children take OC exam seriously, they take selective exam seriously, they take coaching homework seriously, but they don't take schoolwork seriously. And we cannot give results. We cannot write a report card based on what your child is doing at coaching center. I can write only a report card based on what they're doing at school. And at school, they're not doing good enough. So please teach your children, do your best no matter where you are and what you're doing.
Thank you, Saral. Next question. Could you further expand on how to handle students going through trauma and stress, especially when exams get cancelled due to pandemic? Saral, I think this is kind of you segueing into Rajeev and Punka.
Could I request you to repeat that question, please?
Could you further expand on how to handle students going through trauma and stress, especially when exams get cancelled due to pandemic?
It is very tough. It is very tough. And now this is not a primary school related question. Mainly it is HSC related, but our kids have also suffered because OC exams have been postponed. So for our age, parents and students, that itself is an anxiety. So I think what we as a school try to do is we try and send messages to tell them that it's okay, please don't worry, we are there. We will do one-on-one Zoom sessions, like well-being sessions with students. If we are, notified that the child is experiencing a bit of stress or anxiety, when they come back, we do a lot of pep talk with them. And, like Punka and Rajeev has said, it's about modeling. So like parents have a responsibility, we educators also have a responsibility. And I take that very seriously. If I'm going to show to students, oh my God, I'm stressed because OC has been rescheduled, of course my students are going to be stressed. But if I show to them that the world is going through a period of uncertainty and we do best what we can in the situation, I think modeling, keeping calm, managing our own anxiety, we have a big responsibility towards these young people.
Thank you, Sarah. Rajeev, you've touched a tiny bit on dyslexia, and I know it's a topic that would take lots of hours to sort of unravel. There's a question about that. Very often parents are unwilling to accept dyslexia. How would you go about handling the situation when you are aware that the child is dyslexic?
Well, I try something simple first. For example, even the people that I see, I guess approximately half of us here are wearing specs. Yeah. So what does that mean? That means that one part of your central nervous system isn't functioning as appropriately as the other parts are. And by use of an external aid, you're able to correct that particular deficiency and function appropriately. Doesn't mean you have mental retardation, doesn't mean you're intellectually disabled, doesn't mean that you are in some way significantly deficient or different from the rest of the population. Unfortunately, there are instances where one part of your brain that's to do with math, or to do with reading, or to do with writing, or to do with spelling, or to do with a combination of those isn't functioning as well as the rest of the brain. And if that occurs, then unfortunately, you can't go to the pharmacy and buy a reading glass or a writing specs or a math specs and correct it. It's not, unfortunately, as simple as that. And also understanding that this child actually has that problem is also difficult, because this child is quite bright. In most instances, is reasonably bright and can function quite well, except when it comes to that particular subject where the deficiency is quite marked. And that usually gets parents to start to understand, and then having appropriate people assess them to look at where they are. Traditionally, what it means is that there needs to be 2 standard deviations or 2 classes difference in terms of their performance in that particular area or subject as compared to the rest of the cohort. And if that starts to happen, combination of the assessments, combination of their strengths and areas they're struggling in, and then this country is pretty good in the sense. Australia is pretty good. India, I think, is catching up, but Australia is pretty good in that there are in schools, and Saral would know, specific support and help available for those children that are struggling in specific areas. And if they're indeed struggling, then most schools are more than happy and willing to tweak the curriculum for them. And once parents are able to understand and the sensitivity improves, then sometimes you find that the manifestations of sort of school refusal or anxiety for certain subjects or tantrums, all those automatically disappear if there is good understanding all around and support. I mean, you don't, if a child complains of a stomachache, you don't beat the child with a stick and saying, I'm going to beat you if you don't get rid of the stomachache yourself. It's silly. We don't do that. And yet we expect significant disabilities, significant mental health kind of difficulties for these children to somehow just forget, grow stronger and get rid of it. If life were only that simple.
Can I add something here, please?
Oh,
sure.
So the school that I'm currently working in it's a huge school, like a very large school. We have parents who want their child, who they know have special needs. They want them to come to our school. And we tell them, look, we think a smaller school, a more intimate environment will be suitable for your child. But no, just because this school has a great reputation, they do very well in that plan, and they think just by coming to this school, their child will get excellent selective results, their child will get excellent NAPLAN results. No, please, like what we are trying to tell you is, acknowledge the needs of your child and try and pick an environment that will be most suitable for your child. So things don't magically disappear. We have to work towards them.
Thank you, Saral. Are anxiety disorders best treated with psychotherapy or medication, or both? When and how is medication best tapered off?
This is covered, I think, with the social anxiety question. I guess for me to reiterate that it's the pointy end, and as was mentioned before, is where the medication comes in. And particularly when we're working with children, we do try our best to do psychotherapy and work with the environment and see if there's changes that we can do within the environment, as well as others who are in this child's life, such as schools, and perhaps grandparents and significant others. Yeah, so I would say, again, it's contextual, depends on what's happening to the child's life, but we would generally start off with psychotherapy, unless it's the child's daily function is impacted significantly and is not being able to perform on a daily basis. That is when I would see medication coming. Would you like to add to that?
Yeah, so when you look at medication specifically, I think it's for those that either don't respond to psychological forms of intervention, and so there've been a few sessions and things haven't improved, or they're unwilling to even consider it, or the degree of dysfunction is just so great, or the risk is so high. So in some, it can be sort of something is coming up, so HSC is coming up, or they, there's risk of self-harm or things like that. So if the risk levels are pretty high, unfortunately, with the anti-anxiety or antidepressant medications, I think the biggest problem is that they are one of the slowest acting medications known to man. So if I start a medication today, the positive effects will only happen in about 4 weeks' time, or will start to happen in 4 weeks' time. And in fact, side effects appear first, and there can be sort of slight increase in agitation and things like that. So lots of times we might then have, if medications are started without appropriate sort of education provided, then they may say, oh gosh, we've been taking it for 2 weeks and he's gotten worse. It is expected that there is some mild agitation in the first 2 weeks, needs to be managed, needs to be looked after appropriately, and so on and so forth. So really, it's an important decision to be taken. And I think for the teenagers, I don't know if any of you have ever had any experience with antidepressants at all. If you look at if you buy a pack of it, you will have on the pack written, beware, well, not really beware, but a small warning that says, warning, antidepressant medications could worsen suicidal ideation in children. So there's a black box warning on most antidepressants. I don't think we have enough time to go through that, but I do have a spiel that will take about 5 to 10 minutes to explain to parents why that warning is there and why I'm still prescribing medication that obviously says it's going to worsen something that it's supposed to treat. But yes, these are things that are practical, sort of everyday matters that I encounter. So I'm happy to go through that if there's interest.
And just to add to that really quickly as well, is particularly when we're working with young people, teenagers, medication can seem like a quick fix as well. Particularly, it's like, oh, I feel better now, so I don't need to work on things anymore. And what we tend to see is the medication tends to just be containing them. It's not necessarily improving anything because we haven't worked on the deeper issues. Yeah,
the only thing I would look at is I think somebody spoke about I think you spoke about a fracture. So I tend to say that, look, if you've had a fracture of your leg, and you're a runner, and you say you're going to sort of lie down in bed for 6 weeks because it takes that much time for the fracture to heal. And in 6 weeks, 1 day, so 43rd day, I'm going to get down and run a race. Is that possible? That's silly. What you'll need to do, you'll need to first actually learn to hobble to the toilet and back. And you're not going to be walking to the toilet yourself. You're going to use a crutch. And why are you going to use a crutch? You're going to use a crutch because the muscles in your leg need to improve to an extent that it can actually hold your weight when the bone heals. And so just because you're using a crutch as a means to improve the speed at which you recover doesn't mean you're going to be dependent on the crutch forever. So we tend to use medications in the same manner, that it'll help in aid in recovery. It's not a recovery in itself. The crutch doesn't heal the fracture. The crutch helps in recovery quicker, so that you can work on your muscles, work on a number of these other things. But the ultimate aim is to throw the crutch away. Similarly, the ultimate aim is to throw the medications away and not be dependent on that as a reason and cause for your improvement.
The next question is for Rajeev. As part of diagnostic assessment of children, are parents assessed as well in case they have anxiety, depression, adult ADHD, or high functioning autism?
Yeah, look, that's a very interesting point, and I think a trick question. But when I say trick, what I mean is that often, if there is significant or underlying family difficulties, and so sometimes parents might use it sort of against each other to say, well, you are the cause or I am the cause of the reason why these children have difficulties or problems. But again, approaching the question for what it is, look, yes, no assessment is complete without having some kind of understanding of the kind of difficulties parents have experienced. And it's important both for the genes and environment. However, it's parents usually come with expecting some kind of solution for their child. They're not coming in expecting themselves to be labeled as having something. So it needs to be, one needs to be very sensitive and understand that it's a transaction. It is not about the truth and the whole truth. Most families that come to us aren't prepared for the whole truth. And what is the truth really? What I think of it, is that the truth? What the family is experiencing, is that the truth? Is it really important for me to prove my professional capability and say, well, as a professional, this is what I think it is, and you take it or leave it? Certainly not. It's a transaction. It is an understanding and arriving at a consensus. And if I am able to see, oh yes, there are issues in parents that's impacting or hampering the progress of this child, then it is my duty to bring it up sensitively in a manner that the parents are able to take in, understand, and incorporate whatever changes they need to make for the benefit of the children and finally themselves as well. So it's a tricky one because while I might do it, while I might know of it, will I say it every time, each time? Probably not. It'll depend on the circumstance.
Thank you, Rajeev. Punka, anything to add?
No, and I guess what stood out for me when Rajeev was talking about it was more around being non-judgmental. And it is like, the way I see it is they are the experts of their story. My work is to figure out the pieces of puzzles and put it together and help them put it together. I'm not there to judge or tell them that I'm the expert in their life. I'm not. I'm the expert in my skills, but it's definitely teamwork. And parents play a significant role in that teamwork. I can't do it without them.
Absolutely. The reason why I sort of called you out for your comments was your work with detainees in detention centers and things, detainees in detention centers. You would have seen the anxiety and the stress that the parents feel. New environment, new everything. And then they've got children to look after who are there in that center with them. So those anxieties must be rubbing off on parents, and possibly parents are more comfortable saying, I have a problem. I don't. Would you in those cases turn around and say, I understand your child has a problem, but can we talk about you?
Part of that would be validating and acknowledging that this is a very difficult situation that they're in. And in terms of, it would be more around first exploring what they believe that they're doing really well and perhaps what they think that we could work on. And that would be the bridge in to figure out how we could together help that child. So I guess largely the way I work is for all of us to be on the same page, because then we can be more effective as opposed to a bit of a tug of war. So particularly in those circumstances, which are very difficult, we'll start off by acknowledging the difficulties. And again, as I would generally reiterate to them, is I'm not the expert in their life, they are, and they have got a lot of resilience to be where they are right now. So acknowledging that resilience and bringing that as well to the table is really important in order to figure out now, how do we collectively help that child?
Thank you. There's one question where the person asking the question said, and I quote, "With hesitancy, I ask this. Is Prarabdha Karma relevant in depression, anxiety analysis?"
That would be a Rajeev question, because I don't necessarily know that particular word. So I'll leave it to Rajeev.
Yeah, look, I saw who's posed the question, and Padmanji is very learned, and I suppose he knows more about Prarabdha Karma than any of us. Well, I think in more than just Prarabdha Karma, I think one needs to look it. All right, how do I? It's.
Can I expand on the question, Rajuji?
Sure.
Little bit. I won't take time. What I mean is, say your analysis generally shows the environment is perfect or great, the parents are good, the genetic component, probably everything is good. I mean, the teachers, the peer support, and all those things look to be fine, but still, the child is behaving or has got this anxiety and other things. So so you are not able to pinpoint where to or how to address the issue. Then I thought that maybe the child carries this, what we think is the prarabdha karma. Therefore, will you bring that quotient in the analysis? Thank you.
Yeah. No, that's a good point. It's just that we probably won't frame it in that manner, because again, it's a transaction or an understanding between us as the professional and the parent and the child as the sort of expert and the person sort of suffering or having the difficulty. But that is something that's very common in our line of work. When I say common, what's common? Common is that it is often quite difficult to understand or pinpoint the cause. And even in instances where you might be able to understand the cause, it is often not possible to explain that cause to the family appropriately. So yes, we will invoke that kind of a sort of saying to say, well, we have sort of looked at different things, we're not able to find exactly what it is. However, the reality is that here we have a situation with this kind of difficulty and this kind of problem, and let's see what best we can do to try and alleviate the suffering for the child and for people around. That's done quite commonly, not only in our line of work, but say neurologists, 90% of what the neurologists do, say epilepsy, 80 to 90% of epilepsy doesn't have a cause, may not even have a family history, and yet it is present and you might need to treat it. Cancers that Pink Sari have huge experience in, a very, very high percentage of them, you might not be able to pinpoint or understand why it happened. But the reality is that you're dealt with those cards and you face that situation. And yes, from our philosophical perspective, we might understand it as the prarabdha karma, and then we might look to do what best we can given the confines of the current lifetime that we have. But the reality is that this is the situation that we have today, and the dictum is that today is the first day of the rest of your life, and regret is only a retrospective diagnosis. So what is regret? Regret is you think back and say, oh, 2 days ago I made that decision and that decision is wrong, but you're deciding that decision is wrong based on the impact of that decision and the advantage of the knowledge of the impact of that decision that you have today. And on that day, when you actually made that decision, you had no such knowledge, and you made it with the knowledge of the things that you have with you. So going back and beating yourself, about it is just, not going to help today or tomorrow. Lots of people live in yesterday and tomorrow. Very few live in today. Sorry, we can go on, I think, but maybe I should stop.
No, that's great. Thank you, Rajeev. Thank you.
And that sort of concludes our Q&A session. Over to you, Aparna.
Thank you. Thank you. That was certainly a very interesting session. Thank you again once to all the presenters. But before I pass it on to another PSI member to make a formal thanks, my biggest apology, purely because I left the best one to the last, which is one of our PSI members, who I forgot to introduce. And I don't know, it's an oversight. Maybe, as Saral said, I was not stressed enough for this session, and which didn't make me perform that well. So my hands up, apologies there. So ladies and gentlemen, the lady who leads us and keeps us on our toes and works very hard behind the scenes, none other than Shanta Vishwanathan, President of PSI. Huge thank you to her for keeping us on our toes and making us do what we should be doing. So thank you once again, Chantanti, from all of us, especially the PSI team and from the community as well. Thank you once again. Having said that, Kashmira has just posted again the post-workshop survey. Could I please encourage you to take a moment, even before you log off, go and fill in the survey. The purpose of the survey is only for to help us learn better our workshops, keep on doing what we do, and be encouraged enough. And honestly, take your feedback on board and react to it and improve on based on the feedback. So thank you once again for joining us. Apologies, we've gone over. I'm going to, one more thing. If you would not like to be part of our mailing list, please let us know as soon as you get the first email. For people who have left, we'll try and communicate that in the email. So please do let us know. Otherwise, we will be on our mailing list by default from now, but let us know and we'll action it accordingly. Over to my colleague, Rupa Parthasarthi, to convey our thanks on behalf of PSI. Thanks.
Thank you, Aparna. And I would like to give my formal vote of thanks, but what a wonderful way to spend this Sunday afternoon. I think it has been really an informative way to spend this afternoon, particularly for me. I've taken a lot of insights and I've got a notebook full of notes I've made, and I'm pretty sure a lot of them actually took away a lot of key messages. So I would like to start by thanking Saral for reminding us that it is very important to remember that kids are naturally resilient and need to actually boost them in their resilience. Thank you so much for Poonkulali Govintharajah for her insights and taking us through a child's journey in therapy. I feel absolutely privileged to know what happens behind closed doors, because that's information often not privy to a lot of people. So thank you so much. And Dr. Rajeev Jairam, and what a timely reminder to kind of separate and understand that the child is seldom the problem. They have a problem, but they are never the problem. So thank you so much. And thank you so much for spending innumerable amount of time with us and getting this done back of the scene as well. We have a few other members we have to thank who have made this possible. Dr. Saroja Srinivasan, who actually lent her voice and her expertise in speaking in Tamil to promote this event. We've got then other educator, Hamsa Venkat, who came on board to promote this event as well. And I know Saral has done so for us in Gujarati along with Kashmira as well. So thank you so much for your time. We also have all the local news, Indian newspapers and the channels and the publications, SBS Tamil in particular, SBS Gujarati, and all of them who came on board, and all the members who have been with us, and most importantly, the audience members who've been so patient on a Sunday afternoon, giving us your insight and us giving us all your questions and making this possible. So thank you. And we really appreciate your presence and value your time. And thank you for making this possible.
Thank you, everyone. We will close this session I just request all the PSI team members to be online whilst we wait for all the others to log off. Thank you.
Thank you.
Thank you once again.
Thank you.